Hello everyone. Let's start the next slide. It's neurofibromatoma. Neurofibromatoma are local and generalized. The local neurofibroma are appear at any age but commonly seen in the adults. They form smooth and move in lateral direction but not along the direction. Because you see the nerve is like this and it forms like this. So it cannot move on this way. This way it cannot move. It can move up and down, sideways. Acoustic tumor. Acoustic tumor is acoustic as 8th nerve. This is an example of local neurofibroma where the origin is from 8th nerve. Generalized neurofibromatosis or neurofibroma, also known as von Reckling-Ghossain disease. It originates from the perineurium or epineurium of the nerves. It's autosomal dominant condition. Capulate spots seen, which are high brown in pigmentation. Just look a picture of the generalized neurofibromatosis or von Reckling-Ghossain disease on the Google. You will never forget it. Second is men type 2 disease known as multiple endocrine adenopathy. These are also neurofibromatosis which occurs at the lip, eyelid and face. Seen in pheochromocytoma, medullary carcinoma of thyroid and hyperparathyroidism. Now we are discussing malignant neoplasm. Malignant neoplasm are which are more dangerous. They use like a less time to grow and mostly are painful. We have seen the difference in the benign and malignant neoplasm. So first is basal cell carcinoma, also known as rodent ulcer. It originates from the basal layer of the retimalpighi layer of the skin, mostly seen on the exposed part of the skin, where the direct UV radiation and sun exposure is there. They are predisposing factor. Most common location, it's in the upper part of the face. When you draw a line from your pinna to the nose, then it divides the face into two parts. And above the line, it is usually seen. Okay, it's also known as tear cancer. Okay, it's painless but hard in consistency. There will be no regional lymphadenopathy. Second is squamous cell carcinoma. As name suggests, squamous means skin epithelium or epidermal cell layer, mostly seen in old age, seen in burn scar. And the usually burn epithelium epidermis is usually burnt out and it causes cancerous changes in it and used to develop squamous cell carcinoma. Predisposing factor are like a previously irradiated skin or long-standing ulcers. They can be converted into squamous cell carcinoma. Examples are Marjolin's ulcer. They originate from the scar or burn. Bowen's disease is a precancerous condition in which lesion looks like brown, indurated and thickened mass covered with a crust. Paget disease. Paget disease is disease of bone with osteoclastic activity. Coupled with osteoblastic activity, there is increased bone resorption. In Paget, osteoclastic activity is more than the blastic, so bone resorption is more. Leukoplakia is a pre-cancerous condition of the mucous membrane. Wound and scar. It's a different topic. Wound and scar. What is a wound? Wound is a breach in the continuity of the skin. So this is your skin, and anything which breaches the continuity, this is a wound. This is a wound. Scar. When the wound heals, after the healing, there will be a scar. It remember that you had a wound. Okay? Like this. So the scar can be normal, hypertrophic or keloid formation. The hypertrophic scar is the overgrowth of fibrous tissue, which is concerned with the wound healing and strengthening of the wound. This occur in around 2 to 6 weeks. Present with the pruritus, mild itching you feel, but it stay in confines with the original wound. It doesn't go beyond the size of the wound. Okay. Uh, so by mistakenly, so definition of the wound. The place is round. Wound contain blood and fibrin which is replaced by collagen and fibrous tissue. Fibrous tissue is organized to give maximum strength. It's a wound healing. Normally this process is controlled in such a manner that the scar is thin with minimum fibrous tissue. But in certain cases, there may be an excessive amount of fibrous tissue which lead to hypertrophic scar. It depends on person to person. Some patient make wound, some doesn't make scar, hypertrophic scar, some doesn't. So hypertrophic scar look like this. It is confined into the wound, but there is growth. Now keloid. Keloid also fibrous tissue. It occurs after wound healing, but it extends beyond the original margins of the wound or size of the wound. It gradually infiltrates the surrounding tissue as well. Made up of dense collagen. The maximum collagen content of the wound tissue is between 17 to 21st day. It's not a precancerous condition. It's equal incidence in both male and female. Occur after mostly burns, healing up an ulcer, healing up a small boil. The wound which don't like to heal. Such type of wound form keloid. Normal surgical scar also can be converted into the keloid, but the chances are less. If keloid is spread, it's pink in color, it's tender on pressing, and it causes itching. Most commonly seen in tuberculosis patient and black Africans. Most common location is pre-sternal area. This looks like this. The size of the keloid is this much only. Size of the wound was this, but the extension is beyond the margin of the wound. What is an ulcer? Ulcer is a breach in the continuity of the covering epithelium, not complete skin, but just covering epithelium, skin or mucous membrane. Type of ulcer are undermined is, these are the edges. Ulcer has three parts. These are the margin, these are the edges, and this is the floor. This is floor, this is margin, and these are the edges. So here the edges are undermined, mostly seen in the TBs. It destroys the subcutaneous tissue faster than the skin. So skin remain intact and subcutaneous tissue got destroyed. That's how it become undermined edges. Example is TB is the most important and very frequently asked questions. So you can just punch it out like that. It's like with the punching machine you have punched out, like a biopsy. Seen in deep trophic ulcer. Edge is at the right angle of the skin surface. So the edges is the right angle of the skin surface. You will feel there's a 90-degree of angle here. Sloping edges. Let's look like skin is destroyed more than the subcutaneous tissue. Mostly seen in the healing ulcer or a venous ulcer. Raised and pearly beaded edges. This is the feature of the rodent ulcer, where the necrosis has been seen. Here this area will be necrotic. This will be healing area. So the healing area got raised, necrotic area is depressed. So it looks like pearly white beaded edges. Rolled out or everted margins. Where the margins are everted outside, away from the direction of the wound or ulcer. This is the ulcer area and the margins goes away. Feature of squamous cell carcinoma. and ulcerated adenocarcinoma. Ulcer heaps up and spill over the normal skin to produce an evertidasis. Arterial ulcer, as the name suggests, seen in arterial disease like Burgess disease, Raynaud's disease. Most common location is anterior and outer aspect of the leg. Anterior and outer aspect of the leg, dorsum of foot, and below the medial malleolus. Arterial ulcer are painful. You need to remember the difference between arterial and venous ulcer. Where venous are varicose ulcer or post-thrombotic ulcer, they are called as gravitational ulcer. Location is medial aspect of the lower third of the limb above the medial malleolus. The word above is the venous, below is the arterial, because artery, posterior artery, goes below the medial malleolus, not above. Where the veins like saphenous vein or small saphenous veins, they goes above the medial malleolus. They are painless. Arterial ulcer are painful. Trophic ulcer, as the name suggests, trophic means neurogenic. That's because of some neurological disturbances in form of loss of sensation. It causes ulcer. Because when sensation lost, patient can hit anyone or any stone and got injured, and patient not aware of the injury, and it converted into a non-healing ulcer. Mostly seen in the pressure areas where the fit hit the most commonly is like a heel area, ball of great toe, like in ambulatory patients. Non-ambulatory patients, because they are completely lying down on the bed, so the buttock area and the heel area, they are the pressure areas. It causes pressure ulcers or neurogenic ulcer. Tuberculous ulcer, they appear due to the bursting of the caseous lymph node. They are painful. So most common location where the lymphadenopathy is most common, like neck, axilla, groin, they are transverse. This is the most important question. They are transverse ulcer. Typhoid ulcer, they are longitudinal ulcer. So you need to remember TB is the transverse and typhoid is a longitudinal ulcer. So in TB you can remember like this. There is a R in the TB. Okay, there is R. There is R, transverse. R. And here typhoid longitudinal you can remember like tile. Okay, so typhoid longitudinal. Ulceration of Peyer's pitches and may perforate, seen in mostly in the intestine. Ducre's ulcer, they are soft chancre or sore. There are multiple painful acute ulcer seen in external genitalia. Appears 3 days after the infection and discharge copious purulent secretion or C. Erythrocanthroid ulcer or Bajen's disease, it's a disease of young women. Abnormal amount of subcutaneous fat with thick ankle combined with poor arterial supply are the predisposing factor. These ulcers are small and multiple and not premalignant. Barrett's ulcer seen in reflux esophagitis. So these you just need to remember the name, nothing else. So what is aneurysm? Aneurysm is a dilation of local segment of the arterial system. Any tube-like structure like artery, vein, when got dilated at particular one part, is called as aneurysm. Like this. And this is the normal artery, and it got dilated somewhere here, like this. This is called as aneurysm. The commonest cause is atherosclerosis. Most common arteries involved is abdominal artery. Most common peripheral artery to be involved is popliteal artery. Etiology can be congenital like Berry's aneurysm, can be acquired like traumatic, degenerative and infective. Traumatic aneurysm mostly seen in popliteal aneurysm, otherwise degenerative infective aneurysm. Because degeneration and infection, they decrease the quality of the arterial wall, and which leads to, because of the pressure of the blood, the wall get dilated. Marjolin ulcer or hypertensive ulcer, the old is associated with atherosclerosis. Sorry, Martorell's ulcer. Most common site is the skin on the back or outer side of the calf, which suddenly get necrosed, leave a punched out ulcer extending into the deep fascia. Cushing ulcers, they are then seen in the head injury or brain tumors located in the duodenum or the stomach. Curdling ulcer, these ulcers are seen in the bones. You just need to remember the name. Pinpoint ulcer, ulcerative colitis. Bottleneck, amoebiasis. Hunner's ulcer, interstitial cystitis. Dendritic ulcers in herpes simplex. Like you can remember the ulcerative colitis, intestinal disease, and there is a multiple pinpoint hole in the intestine. Just imagine, so you will forget. This is the intestine. There are multiple pinpoint in the intestine. It's a pinpoint ulcer. Bottleneck, you can remember a bottle neck and make an amoeba in it. So, seen in amoebiasis. Hunner's ulcer is interstitial cystitis. So you can form your trick. Dendritic ulcer is seen in herpes simplex. Herpes simplex is a skin disease, and it's like this. So dendritic ulcer in the skin. You can form any trick and just remember it. Burgers disease. Burgers disease is an arterial disease. Okay. It's known as thromboangiitis obliterans. Thrombo means a clot, angiitis means artery, obliterans means obliteration of the artery because of thrombus. It's a gradual inflammatory reaction in the arterial wall with involvement of the neighboring veins and the nerves, terminating the thrombus of the artery. Most commonly seen in men below 40 years, mostly seen in the smokers. Smoking is the most common triggering factor, seen in low socioeconomic classes. Autoimmune etiology and family predisposition is seen, involved in the small and medium size of arteries. Both upper limb and lower limb are affected, but clinically mostly in the lower limb it's seen more. Patient complain of the foot claudication. It's a vascular claudication. When patient walk, after a fixed distance, patient feel pain, and he had to stand for few seconds. The pain relieves, and again he can walk. And pain goes downward to upward. You need to remember the difference between neurogenic claudication and vascular claudication. Okay, in neurogenic claudication, pain starts from upward to downward, and after a variable distance, when the pain occurs, patient had to bend forward or sit down, then pain relieves. But in vascular, pain relieves just on standing. Burger's postural test. In this, patient lie on their back on the bed, and patient asked to raise the leg one after the other, keeping the knee straight. The normal individual leg remain pink even after the 90-degree, but in Burger's disease, the foot becomes pale, not pink. It becomes pale. After 30-degree, if it's becoming pale, it's a severe disease. Raynaud's disease is a disease of young women. Most commonly, upper limb is affected, especially fingers. Thumb is usually associated with migraine. Mainly associated with local syncope, asphyxia, local gangrene. What is Raynaud's phenomena? Raynaud's phenomena is different from Raynaud's disease. The same complaints of the Raynaud's disease occur due to spasm of digital arteries. The attack is usually precipitated due to cold. It is an abnormal sensitivity of the arteriole to cold, and it's a disease of arteriole. The pulse remain unaffected and seen bilaterally. So disease is different thing and Raynaud's phenomena is different thing. Symptoms are the same, but cause are different. Tracheostomy arteries and aortic occlusive disease, also is known as pulseless disease. It involves all the layer of the aortic wall, cause narrowing and obstruction of the major arteries, medium and large size arteries. Most common involved vessel is subclavian arteries. What is Berry's aneurysm? It occurs in the cerebral blood vessels, particularly the circle of Willis, due to congenital deficiency of the elastic lamina at the site of the branchium. Elastic lamina hold the pressure in the arteries. Where it's deficient, then the arterial wall get ballooned and known as aneurysm. Aortic artery, abdominal aortic aneurysm is usually asymptomatic before it ruptures. When it ruptures, it causes pain, immense pain, and sudden hypotension. Most common site is infrarenal and more common in males. AV fistula. What is a fistula? Fistula is a connection between two walled structures. If that connection occurs in between the artery and vein, then it is called AV fistula. Arteriovenous fistula, communication between the artery and the adjacent vein. It can be congenital, can be acquired after the injury. Clinical signs are you see pulsatile swelling, continuous brute on auscultation, and a thrill on palpation because arterial pressure is more, venous pressure is less, so the continuous blood goes from artery to vein. Arteries are deep, veins are superficial, so you don't feel usually arterial pulsation anywhere except where it's superficial, like at the wrist. But veins are superficial, so you continuously feel the thrill. Nicoladni's or Branham's signs, the pressure on the artery proximal to fistula causes swelling to diminish in size and the brute ceases, pulse rate fall. This is the most important question. So it's a very important question. In the Viva or objective exams, they used to ask what is Nicoladni's sign or Branham's sign. Increased venous return result in increased heart rate, increased cardiac output, increased pulse pressure, increased systolic and decreased diastolic pressure, left ventricular enlargement, and overgrowth of the limb. It's all because blood returns fast, because artery to vein is blood bypasses, so heart has to work more. Because of that, left ventricle get hypertrophied. Allen's test is to know the patency of the radial and ulnar arteries. How to do it? You just ask the patient to make a fist and squeeze, then put a pressure on the both radial and ulnar side of the distal forearm. Then release one by one and look for the again pink color of the palm. Okay, Adson's test done in cervical rib to determine the vascular insufficiency. Now venous disorders like varicose vein. Varicose vein, a vein is called varicosed if it is dilated or tortuous. It occurs due to incompetence of their wall. Primary cause is intrinsic abnormality of the venous wall, seen only in humans, mostly seen in women. Occurs commonly in people whose work demands standing for long hours because vein has to take the blood anti-gravity from foot to the heart, and they has multiple valve in it to prevent the backward or to decrease the gravitational force on the blood column. But when the valve get incompetent, the blood column, because of the gravity, it goes down and the wall of vein is very thin, so it gets swelled. Not swelled, but like a tortuous or dilate because of the pressure. and can be seen secondary to any obstruction like hampers venous return, like abdominal tumors, pregnancies, which press the veins in the abdominal veins major. The symptom of the varicose vein is commonest symptom is the pain, which is aching sensation felt in the whole leg or in the lower part of the, particularly at the end of the day, because in the daytime they has to work. At the evening it is most symptomatic when the patient came home after working. Complications are edema, thrombophlebitis, hyperpigmentations, lipodermatosclerosis, ulcerations. Gold standard test for varicose vein is duplex imaging. Need to remember the word duplex imaging. DVT is not a complication of varicose vein, but it's seen in case of DVT. DVT is a different thing, varicose vein is a different thing. Bursting sensation is seen in DVT, not in varicose vein. Phagmacia alba dolens, also causes wart leg or milk leg. There is a swollen limb with excessive edema due to deep femoral vein thrombosis. Then it's known as alba dolens. Alba means white. Alba is a Latin word. It means white. Lipodermatosclerosis, skin changes seen in the chronic venous insufficiency. Skin becomes hard and woody, fibrous, and thickened. Most common site is gateway areas above the medial malleolus. So this is the picture of the Brody's Trendelenburg test. These are the varicose vein. Brody's Trendelenburg test determine the incompetency of the saphenous femoral wall and their communicating system, perforator incompetence. The patient is placed in the recumbent position. Legs are raised to empty the vein. Okay, it can also be done by milking the vein proximally. The saphenofemoral junction is now compressed with the thumb or tourniquet applied just below the saphenofemoral junction, and the patient is asked to stand up quickly and the pressure is released. Test is called positive when veins fills very quickly, means incompetence of the saphenofemoral vein, or gradual filling of vein is incompetence of the communicating valve. Morrison's cuff impulse test is saphenofemoral valve incompetence. Patter's test to know the position of the leg perforators. Tourniquet test to know the position of the incompetent communicating veins. Most important perforator of the lower limb is between long saphenous and femoral vein. You just need to remember the name of the test, like Morrison's cuff impulse test किसके लिए यूज होता है, तो ये saphenofemoral wall incompetence के लिए करते हैं. Bread test किसके लिए यूज होता है, that's all. Deep vein thrombosis, DVT, is also known as phlebothrombosis. Deep veins are like tibial veins, peroneal veins, popliteal veins, and femoral veins. They are well supported by powerful calf muscles, like gastrocnemius soleus. If the calf muscles are in complete rest for a long time, the blood flow through to these veins become very slow, and it may form a thrombus and lead to DVT, like in a post-traumatic condition where the patient has leg put into the plaster and patient is lying down for weeks. Then there will be no muscle contraction in the leg, so vein can be thrombosed. Earlier sign of DVT is swelling of the calf muscles. Most common site of thrombosis is calf. Most common site of venous thrombosis is in the soleal vein. Symptom of the DVT. Onset of the symptom are often sudden bursting type of pain in the calf and whole of the leg with swelling and discoloration. Risk factor other. After major joint surgery like total hip replacement surgery or prolonged immobilization due to trauma, pregnancy, obesity, MI, high dose of prostitution can lead to coagulopathic disease. There is a sign, there is a Homan sign. Homan sign is you hold the knee in extension and Pull the ankle upward. So it goes stretching of the calf muscles, and if it is cause pain, then it's positive. Second is Moses sign. You squeeze the calf muscle. If it cause pain, then it's a positive sign. For this test, the affected lower extremity is wrapped with elastic bandage and the patient is asked to move around and exercise. In DVT, severe complaining of the pain will be seen. Fagan's test, it indicates the site of perforator. Investigation of choice in DVT is venous or arterial Doppler. The most common sign are asked the Hormone sign and Moses sign. What is Virchow's triad? The three influences that predispose to thrombus formation. First is endothelial injury. Second is vascular stasis or turbulence of the blood flow. Third is blood hypercoagulability. Now we come to lymphatic disorders. Hodgkin's disease, also known as lymphedema. Lymphedema is characterized by glandular enlargement, most common feature. This most commonly start in either supraclavicular or jugulo-digastric group, mediastinal group. Enlargement of spleen and anemia of secondary type. Macroscopically, fish flesh appearance. Microscopically, red Sternberg cells are seen. Just to remember, microscopic cells in lymphedema are red Sternberg cells. Macroscopically, fish flesh. Okay, it's edema, lymphedema. Wherever the lymph node are seen, they get edematous and enlarged. Most common site of lymph nodes where the whole body's lymph node come is supraclavicular region. So this is the most important group which has to be involved. Four main histological type are nodular sclerosis, which is most commonly mixed cellularity seen in HIV, lymphatic predominant, so good prognostic, and lymphatic depletion is the worst prognosis seen in HIV. So 2 and 4 seen in HIV. Lymphedema most commonly seen in young adult, commonly male. They are painless. Progressive enlargement of lymph node is commonest presentation. Lymph nodes are rubbery and firm and elastic. Palpabstine type of fever is seen. Irregular temperature, recurrent attack of the remnant fever are the seen. These are the like a common feature, but few different diseases have different presentations. Like rubbery fillings are seen in the tuberculosis also. Hard fillings are seen in the Hodgkin's lymphoma. So you need to remember those. Clinical staging is a question asked on the name and Arbor system. Stage 1 is a single group of node above the diaphragm. Stage 2, involvement of the two group of the node above the diaphragm. 3 is both above and below the diaphragm, and 4th is generalized lymphadenopathy. Investigation of choice is biopsy. DD, discrete and shorty lymph node seen in syphilis. Stony hard secondary carcinoma, matted tuberculosis, rubbery Hodgkin's. Okay, these are the important. Milroy disease are the congenital lymphadenema of familial origin. Most common cause of unilateral lymphadenema of lower limb in India is filariasis. Hathi paw.